I am Chicago DLS Inc. I do group sessions and one-on-one tutoring for the Naplex and the MPJE. If you have any questions, please save them for the end of the presentation. You can always send me a DM. The resource I use for these mini lessons are RxPrep and Pass Naplex Now. Both are great resources. Whichever one you decide to use for your prep, make sure you go all in. If you're reviewing any topics and you feel like there is not enough information with the resource that you use, make sure you supplement it. If you have taken the Naplex before and would like me to review your score report and give you feedback, feel free to send me a DM. And if you have taken an assessment and this is your first time, same goes for you. Send me a DM and I'd be happy to provide you with feedback. All right, let's get started. So, the prostate is a walnut-sized gland located at the base of the bladder, and it surrounds the male urethra. On the left side, on the graphic, the left side is a normal prostate and a normal urethra. Urethra being where the urine passes from the bladder to the external. And on the right side, you'll see an enlarged prostate, and the urethra is compressed, and urine is unable to flow freely. Now it secretes fluid that becomes part of the seminal fluid carrying sperm. It depends on androgens, which is testosterone and dihydrotestosterone, for development, maintenance, and function. 5-alpha reductase converts testosterone to DHT, and DHT is responsible for normal and hyperplastic growth. Now, hyperplasia causes what we call LUTS, lower urinary tract symptoms. And this is because of the bladder outlet being obstructed directly with an increase in smooth muscle tone and resistance. Normally, this happens in patients that are greater than 65 years of age. Now, drugs that can worsen BPH, benign prostatic hypertrophy. And on the right side, the picture is of a centrally acting anticholinergic, benztropine. And in addition, testosterone products, SNRIs, diuretics, caffeine, as well as antihistamines, decongestants, phenothiazine, such as prochlorperazine, and then tricyclics due to their anticholinergic effects. One of those is going to be amitriptyline. Can anyone tell me a brand name for amitriptyline? Please type it into the chat. Amitriptyline. It's okay if you don't know. Definitely make a note to review if you do not know. On the resources page, Suspicious Bunch has linked top 200 and top 300 brand names. And I think it is important. I counsel all of my students. The top 300 is very, very important in terms of brands and generics. Some questions on the Naplex will have all brands, some will have all generics, and you don't have to do all 300 at once. You can break them up 10 to 20, 30 at a time, whatever your mood is. If you answered Elavil, that is correct. Great job to you. All right. So symptoms of BPH are going to be increased frequency, meaning that you have to go more times, straining to urinate, weak stream, and hesitancy. There can also be urgency, meaning you feel like you need to go, leaking, dribbling, and nocturia, which is needing to wake up at night to urinate. A clinical pearl for you. A patient won't be able to tell you how many times a day they urinate. However, if you ask the patient how many times did you wake up last night, or have you been waking at night, they'll be able to tell you because that's something that the patient will remember. You yourself should think, did I wake up last night to use the bathroom? And you'll know yes or no right away. But if I ask you how many times have you been to the bathroom today, you may not be able to recall that. Incomplete bladder emptying and obstruction, which can lead to renal symptoms as well as renal failure. All right. So, uh, drugs for BPH, first line is going to be alpha blockers, and they're the the treatment, first line treatment for moderate to severe symptoms. Mechanism of action here, they inhibit alpha 1 adrenergic receptors, relax smooth muscle in the prostate and bladder neck, which improves urinary flow by reducing the bladder outlet obstruction. There are three types of alpha 1 receptors. Can you tell me where they are found? Put it into the chat if you recall. We have alpha 1 receptors. Where do you find them? Don't have to know all three. All right. While you're typing that into the chat, let's talk about non-selective have greater adverse effects or side effects than selective alpha blockers. Floppy iris syndrome, there's reduced iris muscle tone during cataract surgery due to alpha 1 blockade. So there's one answer. The muscles of the iris have alpha 1 receptors. I'm seeing heart, I'm seeing arteries. That is correct. In addition, smooth muscle of blood vessels. Very, very good. Keep those answers coming as well. So let's talk non-selective. We have doxazosin, immediate release, 1 mg at night. We titrate slowly to 4 to 8 mg. Doxazosin is also available in an XL version, 4 milligrams daily with breakfast, max of 8 mg. Terazosin is 1 milligrams at night, titrate slowly to the max of 20 milligrams. Selective alpha blockers are going to be tamsulosin, and that's going to be 0.4 mg daily, 30 minutes after meal at the same time every day, max of 0.8 milligrams. Also, we have alfuzosin and silodosin. All right, continuing with alpha blockers. On the right, we see Flomax, and that's going to be tamsulosin, which we use for BPH. Alpha blockers can also be used for the treatment of hypertension, which we'll discuss at a later date. Prazosin is known as Minipress, that's for hypertension. Doxazosin, brand name is Cardura, can be used for both. Terazosin is Hytrin, can be used for both. And doxazosin extended release is going to be Cardura XL, that's only for BPH. Alfuzosin is available in an extended release form, that's going to be Uroxetrol, and silodosin is Rapaflo. The alpha 1 blockers used for BPH have less dizziness and hypotension. However, there are more incidences of abnormal ejaculation. Relaxing the bladder can cause semen to go backwards due to the bladder during ejaculation. This is known as retrograde ejaculation. Continuing with treatment and dosing, um, prazosin, it's short acting, it's not used for BPH. due to the need of frequent dosing and potential for more cardiovascular side effects. So, looking at doxazosin, we talked about the dosing. Um, in addition, the extended release form and terazosin. Now, tamsulosin, brand name is Flomax. It does have a sulfa component, so if the patient complains or reports a sulfa allergy, make sure that tamsulosin is crossed off. Uh, we increase the dose in 2 to 4 weeks. It is contraindicated with strong 3A inhibitors. Tamsulosin is a major 3A4 substrate. Can anyone tell me a 3A4 inhibitor? 3A4 inhibitor into the chat. Here it says strong, so let's try to stick to the strong. I will accept moderate, however, I prefer strong. Very good. Alfuzosin extended release is uroxetrol, and it's 10 milligrams once daily after the same meal each day. No titration necessary. Swallow whole. Excuse me. Caution with creatinine clearance less than 30 mils per minute, and it is also contraindicated with strong 3A4 inhibitors. All right. Silodosin is Rapaflo. There's no need for titration here. Creatinine clearance, 30 to 50 mil per minute. We reduced the dose 50% to 4 mgs, and it is contraindicated if the creatinine clearance is below 30. It's also contraindicated with strong 3A4 inhibitors because it is a major 3A4 substrate. So, carbamazepine is actually an inducer, and we're looking for inhibitors. Verapamil is moderate, but I will accept it. Good job. Protease inhibitors, that is a strong 3A4 inhibitor. Good job there. And we also have a mnemonic, C Pac-Man or G Pac-Man. Great, great. All right, next we'll talk about alpha blockers, their side effects or their adverse effects. So first dose phenomenon with orthostatic hypotension. That's why most of them are dosed at night. Dizziness, lightheadedness, headache. There can be palpitations due to reflex tachycardia. And if there's severe hypotension, the patient can experience syncope, which is fainting. The floppy iris syndrome can occur during cataract surgery. The muscles of the iris have alpha 1 receptors. The patient should inform the MD that they have been on an alpha 1 blocker. It is most common with tamsulosin because tamsulosin is extremely selective. And then retrograde ejaculation, which we discussed earlier. Alpha 1 blockers, they're drug interactions. We have hypotension with erectile dysfunction drugs, which will be the PDE5 inhibitors. In the chat, can you type in what PDE stands for? Once again in the chat, PDE, what does that stand for? So we have Cialis, Levitra, Viagra, or Stendra, and that's going to be the tadalafil, vardenafil, sildenafil, or avanafil. We advise patients to separate the doses by at least 4 hours. Now, alfuzosin, which is uroxetrol, extended release, and silodosin, which is Rapaflo. This is contraindicated with potent 3A4 inhibitors such as ketoconazole, itraconazole, and ritonavir. So if you answered phosphodiesterase, I Commend you. Great job. All right. Continuing to the next slide. All right. Other drugs for BPH, we have 5-alpha reductase inhibitors. Now, if you recall, 5-alpha reductase converts testosterone to DHT, and therefore, if we're inhibiting it, it will inhibit the conversion. So, finasteride and dutasteride are the two alpha reductase inhibitors. Can anyone tell me a brand name for finasteride and a brand name for dutasteride? You can tell me one, you can tell me both. I will accept it. Now, these are used in combination with alpha blockers to improve symptoms, decrease urinary retention, and possibly avoid surgery. So, finasteride, we'll wait on the brand name, is selective for the type 2 enzyme, which is prevalent in the prostate, and we do 5 milligrams daily. Dutasteride is going to be non-selective. It's both type 1 and type 2. We use 0.5 mg daily. So for finasteride, if you answered Proscar, that is correct. So good job there. And if you, I don't see, oh, here we go. Avodart for dutasteride, that is correct. Great. And Propecia is also a brand name for finasteride when used for hair loss. All right. Great job, everyone. Continuing, some contraindications. Women of childbearing potential pregnancy have to be careful with the handling of these. So, if you're working in the pharmacy and you're handling these medications, definitely take the precautions. Now, this class of drugs may also increase the risk of high-grade prostate cancer. Adverse effects are going to be impotence, loss of libido, breast enlargement, and tenderness. Monitor PSA and urinary symptoms, and it is on the NIOSH list of hazardous drugs. You may come across a NIOSH question for Area 6. All right. Continuing to phosphodiesterase 5 inhibitors. So their mechanism of action is going to be decreasing smooth muscle and endothelial cell proliferation. There's going to be a decrease in nerve activity and increased smooth muscle relaxation, along with tissue perfusion of bladder and prostate. So tadalafil is the only FDA approved treatment of BPH, and that can be with or without erectile dysfunction. 5 milligrams daily, same time at night. And the contraindications are going to be do not use with nitrates. You want to have a 48-hour gap between the two. There can be impaired color discrimination, vision loss, hypotension, priapism, as well as 3A4 inhibitors. Adverse effects we have to watch out for, or the patient may complain about headache, flushing, dizziness, and dyspepsia. We'll monitor the PSA, the blood pressure, and urinary symptoms. And there's a picture of tadalafil on the bottom right. Can anyone tell me a brand name for tadalafil? Bonus points if you're able to tell me the brand name of tadalafil and finasteride, the combo. There is a combo pill of finasteride and tadalafil. Does anyone know the brand name? All right, good. We'll wait for that to come in and we will continue. So some counseling points. On the right side, you'll see a bottle for saw palmetto, and that is the plant to the right. The American Urology Association does not recommend natural products such as saw palmetto. With alpha blockers, we worry about orthostasis as well as the cataract surgery. Doxazosin and terazosin, which are non-selective, we take at bedtime. And we have to counsel the patient about the ghost tablet in stool. So first, Cialis is correct. If you, for the brand name for tadalafil, good job if you chose that. Now, Jalen is actually dutasteride and tamsulosin. And Tadfi is going to be the brand name that I was looking for. I'm going to type that into the chat. So the bonus points were actually going to be a brownie, and I will eat that for you. So very, very good, those of you that got Cialis. And good that you know Jalen. Just remember, Jalen is dutasteride, not finasteride. So, psilocin, retrograde ejaculation, uh, 5-alpha reductase inhibitors. We talked about the sexual dysfunction. Avoid in pregnancy because it's teratogenic, and take precautions in handling. With PDE5 inhibitors, we need to be cautious due to additive hypotensive effects. Can anyone tell me what a ghost tablet is in the stool? And do they know any other medication besides Cardura XL that has a ghost tablet? All right. So we'll wait for everyone to tell me you all have a chance about the ghost tablet and any other medication that may have it as well. And then we'll talk about some practice questions. Okay, so all of you are correct that have answered. I have Concerta. I have Oros, which is the oral controlled release. I just had it. Osmotic controlled release oral delivery system, uh, which I guess it should be OCRODS, but who am I? So ORO stands for, once again, Osmotic Controlled Release Oral Delivery System, and it is the shell from the capsule, so the medication has been distributed, and it's just the tablet or the outer casing. So I have here nifedipine good, glucophage good, Concerta good, mesalamine also, um, as well. As well. All right, great job. Now we're going to go to practice questions. I think I have 5 of them. And what I'm going to do is I'll read the question. When I'm done reading the question, please type your answer into the chat or answers. And if you don't know, feel free to put a question mark next to your answer, indicating that it's a guess. Remember that there are no points off here for the wrong answer. Here is the place where you're supposed to get something wrong so you're able to review it before the actual Naplex. Feel free to guess and not put a question mark by it, whatever you are comfortable with. So, first, nope, a 72-year-old male presents to his PCM with continued increased frequency and urge to urinate and cannot completely empty his bladder. His past medical history is significant for hypertension, hyperlipidemia, BPH, GERD, and hypothyroidism. He currently takes lisinopril 10 mg daily, amlodipine 5 mg daily, atorvastatin 40 mg daily, tamsulosin 0.4 mg daily, omeprazole 20 mg daily, and levothyroxine 125 micrograms daily. Based on the size of prostate and lack of effectiveness with current therapy, his PCM elects to initiate Avodart 0.5 mg once daily. What counseling points would be appropriate for a patient regarding Avodart therapy? Select all that apply. While Avodart will help BPH symptoms, it will decrease risk of prostate cancer. That's choice A. Choice B, maximal effects of Avodart will occur within first month of therapy. Choice C, once initiating Avodart, do not donate blood until Avodart therapy has been discontinued for at least 6 months. Choice D, women of childbearing age should not handle Avodart capsules due to potential risk to male fetus. Choice E, our patient's tamsulosin should be discontinued once patient has been on Avodart therapy for 30 days. Remember, this is a select all that apply question. Both RX Prep and the past Naplex Now Q banks do a great job not setting any patterns. It can be one answer, it can be all the answers, and anything in between. Same on the Naplex, there is no pattern. It's important to know your stuff. All right. Go ahead and put your answer choices in whenever you're ready. All right. Anyone else? All right. Very good. So the correct answers are going to be pause. All right. Sorry about that. Can you see the screen? I had the arrows going the wrong way. The correct answers here are going to be C as in cat and D as in dog. So, as we talked about, Avodart is dutasteride. It is a 5-alpha reductase inhibitor. And in patients that have significantly enlarged prostates, it improves symptoms of BPH. So A is incorrect. Uh, there is, it's just incorrect as written. Choice B is incorrect because these agents should be trialed for at least 6 months before making a decision to stop or change the therapy. Choice C is correct as written. These are the current blood transfusion guidelines and blood donation guidelines. We want to limit any exposure for any females of childbearing age or pregnant patients. D is also correct as written, as we discussed, with it being teratogenic. Choice E is incorrect because both of these agents should be used combination long term. So, once again, the correct answer choices are C and D. Does anyone have any questions or concerns for practice question 1? All right, if you think of one later, I'd be happy to answer it. We'll move on to practice question 2. Which of the following hypertension medications can also be beneficial for BPH symptoms? Choice A is Norvasc, choice B is Hytrin, choice C is Zestrel, and choice D is Lasix. All right, so the correct answer is B, which is Hytrin. Hytrin is terazosin, which is an alpha blocker, and it can be beneficial for both hypertension and BPH. In fact, it's only used, the alpha blockers are only used if the patient, mostly only used, excuse me, if they have BPH and hypertension. And then Blessed One asked which drug would be applicable for choice A if we go back, and that's going to be uh, which medications can decrease the risk of prostate cancer, and that's going to be the DHT lowering drugs like finasteride and dutasteride. So I thought that was a great question. Going back to 2, if you chose choice B, great job. Even if it was a guess, great. Any questions or concerns before we move on to number 3? Okay. A 78-year-old male has a history of diabetic neuropathy and BPH. He presents with symptoms of worsening neuropathy. He has been treating it with over-the-counter Tylenol. Which medication would be least appropriate to initiate? Choice A, duloxetine. Choice B, amitriptyline. Choice C, pregabalin. Choice D, Neurontin. Oh, oops. All right. So the correct answer is choice B, amitriptyline or Elavil. It may be useful for neuropathy in certain patients. They are highly anticholinergic and could lead to urinary retention. That's not going to be ideal for a patient with BPH. So if you chose choice B, amitriptyline, great job. All right. Now, practice question 4 says TB is a 68-year-old male who presents to the community pharmacy with new prescriptions for Pred Forte 1% and Vigamox 0.5% ophthalmic solution. He states that his eye doctor wants him to start these medications the day before his cataract surgery next week. While talking to him, you notice that his eyes are cloudy and he seems to be squinting to read signs. He also requests refills on his prostate medications. You inform the patient that you would like to review his profile and will be back shortly. New prescriptions, Pred Forte 1%, 1 drop, OUQID for 2 weeks. Start 24 hours before procedure. Vigamox 0.5%, 1 drop Q8H for 7 days. Start 24 hours before procedure. Medication on profile, amlodipine 10 mg, 1 tablet POQD, quantity 90, last dispensed 2 months ago. Metformin 1000 milligrams, 1 tablet POBID number 180, last dispensed 2 months ago. Toprol XL 50 mg, 1 tablet POQD, quantity 90, last dispensed 3 months ago. Flomax 0.4 mg, 1 capsule POQD, quantity 90, last dispensed 3 months ago. Avodart 0.5 mg, 1 capsule POQD, quantity 30, last dispensed 1 month ago. After reviewing TB's profile, what is the best course of action for the patient? Select all that apply. Choice A, counsel the patient on his risk for floppy iris syndrome. Choice B, counsel the patient to shake the Pred Forte eye drops well before using them. Choice C, inform the patient that the metformin should be held for 48 hours after the procedure. Choice D, contact the patient's urologist to inform them that concomitant use of Flomax and Avodart is contraindicated in BPH. Choice E, counsel the patient to wait 5 minutes between using the 2 eye drops. All right. This is a long question. Anyone else have any choices for practice question 4? Remember, this is a select all that apply. Okay, very good. So E is a correct answer choice. B is also a correct answer choice, and A is also a correct answer choice. So if you chose any or all of these answers, great job. Let's talk about why. E is correct because patients should wait at least 5 minutes between different eye drops. We want to minimize washing out of the previous eye drops and maximize absorption. Choice B is correct because Pred Forte is a suspension eye drop, so it should be shaken prior to use to ensure uniform dispersion of active ingredients. Choice A, we discussed. There are alpha 1 receptors in the eye. Blockade can result in inhibition of the contraction of the iris dilator. So, while it's going to relax the smooth muscle in the bladder neck and prostate, which results in improved urine flow and decreased symptoms of BPH, it can also affect the eye, leading to complications during cataract surgery. Now, C is incorrect. We, prior to major surgery, we can withhold metformin, uh, and with procedures that involve iodinated contrast. So this procedure would not require holding of metformin, and even if there was contrast involved, we would contact the prescriber to discuss the best course of action. Choice D is also incorrect. I think we talked about this in a previous question. Um, both of these classes, alpha 1 blockers and 5 alpha reductase inhibitors, can be used together. Um, alpha 1 blockers act quicker, days, and 5 alpha reductase inhibitors usually take 6 months. They can take a little longer as well. So this covers, this question actually touched on 3 different areas of competency, areas 1, 2, and 3, and identifying drug characteristics, which is area 2, developing or managing treatment plans, which is area 3, and area 1 is going to be obtaining, interpreting, or assessing data, medical, or patient information. So good job on this one. Anyone have any questions or concerns for practice question 4? There is one more practice question. Blessed one asks questions that cover several areas are worth more points. I don't know anything about that. And probably each question on the Naplex only applies to one area. I do what I like to call cross competency questions to test multiple parts of your brain and or multiple areas of knowledge. I feel that it helps prepare you even better. All right, moving on to practice question 5, last but not least. A female patient comes into the pharmacy to pick up her husband's prescription. She is of childbearing age. Which medication would you caution her about giving or touching? All right, very good. It looks like we have a consensus for this one, and it is going to be choice C, finasteride. So we had discussed that it can cause birth defects, um, and definitely need to use caution, especially when they are broken or crushed, and the risk of possible exposure. And if you recall from the presentation, it is on the NIOSH list of hazardous drugs. Okay, so that is the end for BPH. Happy to answer any questions or concerns that you may have for today's presentation, the MPJE, or the Naplex in general.